Good morning, good afternoon, and good evening. Whenever you are, welcome to the E-Institute webinar series, today with the topic on World Development Report 2015, Mind and Culture. The World Development Report 2015 is based on three main ideas: bounded rationality, which limits individuals' ability to process information and lead them to rely on rules of thumb; social interdependence, which leads people to care about other people as well as the social norms of their communities; and culture, which provides mental models that influence what individuals pay attention to perceive and understand. Our speaker today is Varun Gori, Senior Economist with the Development Research Group of the World Bank and co-director of the World Development Report. With further ado, let's start with the presentation. Thank you.
Hello, everyone. Good morning, good afternoon, good evening. It's very much a pleasure to be with you, and thank you for joining in to hear about the World Development Report 2015. Our title is Mind and Culture. It's a somewhat unusual title for the report, and we think it's also a somewhat distinctive report. Rather than focusing on a sector or on even an economic problem, we're focusing on an approach. That approach that we want to emphasize puts decision-making at the heart of development policy and development practice. Recent decades have witnessed an explosion of interesting research in fields such as behavioral economics, psychology, sociology, anthropology. Many of these fields have given us a new understanding of decision-making and behavior, and we think it's time to integrate all of this knowledge, much of it which is very promising, and bring it to development policy, development practice, and development theory as well. In many cases, we don't yet have definitive answers to some of the questions, to some of the problems that we face about development as they relate to decision making. But we think that asking the right questions is crucial, and the research is very promising in that regard. Our main contribution, we think, is that a realistic understanding of how people make decisions and how they behave will help us do development much better than we have in the past. Let me now turn to a couple of the goals of the report. Our first goal is to change the way we think about economic development by integrating knowledge about decision-making that's scattered across several disciplines. That's a mouthful. It obviously refers to the point I just made about recent research, but let me expand that a little bit. Every policy uses and relies on assumptions about human motivation. Sometimes these assumptions are explicit. For instance, we often think that people take action if and only if the benefits of doing so exceed the costs. Something like that was behind policies we have had with regard to user fees for education. The thought is that when there's a small fee for education, people will think about the long-term benefits of education, compare it to the small fee, and still enroll if it's in their interest. At other times, these assumptions in policies are implicit, as in the idea that giving people more choices always makes them better off, or in the idea that people think about land as a commodity, something to be bought and sold, the way that we often do, abstracting from the social meanings that inhere in land and the environment in some instances. As these examples suggest, making these assumptions is not easy. In fact, our assumptions about how other people make decisions are sometimes mistaken. As the economist John Clark said about a century ago, if the policymaker does not examine psychological mindsets, he has to make up his own, and those can be mistaken or misguided. This is so for several reasons. The first reason is that not all people are motivated the same way. People's mindsets vary enormously. There's diversity in terms of the cognitive capacity people have, the capacity for self-control, cultural meanings, orientation towards others and to generosity and altruism, and sophistication about the biases that you have. Policymakers need to abstract about all these things As the political scientist James Scott said, policymakers typically try to make things legible, understandable, by assuming a kind of uniformity. That has been helpful at times, but as we will argue in the report, that often gets in the way of good policymaking. Second, context matters a lot. So the same person will decide differently if subtle cues, which are typically invisible to the policymaker, are changed. In other words, the diversity I just described is contextual. It doesn't only arise from different types of people, but from different environments. It's often the case that policymakers don't come from that they do come from privileged backgrounds and don't understand the context of poverty. Then finally, none of us is all that good at guessing the motivations of people who are different from us or who are far away. For instance, people are often reluctant to ascribe complicated emotions, love, hope, resentment, to outgroups. They typically think that only people close to them are capable of complicated emotions. Many people also believe incorrectly that others are not doing as much strategic thinking as they themselves are. The main thrust of our report will be that we can do better, that the research that I just mentioned provides a great deal of understanding about how people actually make decisions, how they behave, how they choose, and we can improve our policies by targeting how people actually think, how they actually behave, rather than simply modeling it in a relatively abstract way. That leads then to the second goal, which is to enrich and expand the policymaker's toolkit. If you take this seriously, what this means is that our typical instruments in policymaking, which involve changing prices, providing more information, regulating, now have a psychic depth. You have to think about how people respond to them in a variety of settings. For instance, in case of prices, as the psychologist Dan Ariely says, 0 might be a special price, different than just a couple pennies more. That's important when we think about preventive health, for instance. We think about information. We typically think that information is about standards for the public sector or the private sector, performance, how good services are, outcomes. But other kinds of information are crucial too, such as information about how other people are acting, or emotional information. And then finally, regulation also has psychic depth. Regulation and law are not just command and control devices, but they are also expressions of what people, the society believes, which shape norms and shape how people think about themselves and other people. We are going to describe how those tools in the toolkit change in light of a more realistic view of decision making, and also talk about new ideas, new approaches that emerge from them. Let me emphasize a caveat, which is that this approach won't solve all of our problems of development. A variety of structural issues remain. We still have to worry about prices. We still have to worry about technology, which are all important. But it does suggest that some problems can be addressed in a very cost-effective way in light of this new understanding. So let me tell you a little bit about our main ideas. We have 4 ideas that we're going to try and put forward. The first is the idea that paying attention is costly. People have limited bandwidth. Economics is the science of scarcity, but we typically don't think about the fact that attention itself is a limited resource, a scarce resource. When we focus and think hard, our heart rate speeds up, our pupils dilate. It actually costs biological energy to pay attention. It is scarce. You might think about times when you're trying to multitask. Multitasking itself is a misnomer. You're typically focusing on one thing at a time, but you're jumping back and forth. When you're trying to park a car, find an address in a car at someone's house, you typically turn down the radio because it's too much information to handle. That's because attention is a scarce resource. Now, what does this mean for development policy? There are 3 kinds of policy ideas that this suggests. The first is that we may want to focus on rules of thumb, not making information very complicated. For instance, in financial literacy programs, it's been shown that focusing on main large ideas, the simple rules of thumb, is more effective, can be more effective than giving people all the details about how it's supposed to be done, which is how training sometimes works. We can also think about procedural simplification. to enroll in a variety of programs, whether it's conditional cash transfers or school or health insurance, we ask people to sign up. When we ask people to sign up, that's not costless. People have to go through that sign-up procedure, and that can block the utilization of the services we want and not improve development outcomes in the way that we like. Finally, we can think about physical design as a way to keep in mind that people have limited bandwidth. There's a line, often in many environments, there's a line down the middle of the road to sort of guide you on one side of the street. We can think about those kinds of physical design enhancements to make development policy better. We can, for instance, do child nutrition either by providing lots of rules to mothers about how to provide solids to their kids, or maybe design a bowl which itself encodes the kind of information we want to convey about how much proteins, how much carbohydrates, and how many vegetables in it. So those are some thoughts about bandwidth. The second main idea we want to emphasize is that there are intention-action divides. Self-control is hard. Many of us want to lose some weight. Some of us want to quit smoking. Most of us want to save more than we do. We have the intention to do it, but something gets in the way. There's a new sweet, a new dessert that's attractive. The smell of cigarettes prompts us to behave. You might want to save, but oh, there's a new iPod available or an iPhone available, and boom. This affects us, but it affects everyone in the world, rich and poor. What does this mean for development policy? There are a few policy ideas that come to mind. The first are commitment devices, and I'll say a word or two about this in a minute. This is basically the idea of a lockbox. You put away your savings, you don't touch it. You're forced not to touch it. We can offer these to people to help them stick to their intentions. The second involves the timing of subsidies. Sometimes people want to, say, enroll their kids in school but don't manage to save enough to pay the school fees. If that's the case, maybe we should change the timing of transfers, conditional cash transfers, for instance, to coincide with the moment right before the school fees have to be paid. So people don't have to wait you won't have to hold on to that money for as long. Same might be true about farmers who need fertilizer for next year's crop. Maybe we could allow them to purchase the fertilizers and facilitate that purchase right at the time of the harvest when they have some cash, rather than waiting until later. We can think about reminders to help people save, to help people stick to the other actions that they want to follow through on. We can change the default options on a variety of programs that people are automatically enrolled in something rather than choosing to enroll in it. This has been powerful when it comes to savings programs, for instance. Finally, we can support self-control. Think of it as a muscle to be strengthened, nurtured, supported by starting at a young age. That's the second idea. The third idea involves social meanings. We see through a cultural lens. When we think about words like honor or government or leader or woman, those vary from culture to culture. We don't get to choose the language we speak in. We don't get to choose the environment into which we are born. And those shape our sense of ourselves, our sense of people around us, and our possibilities. Aspirations matter a lot, so do role models. There are a variety of programs under the broad lens of entertainment education in which not just information is conveyed to people, but aspirations, hopes through soap operas, changing who gets to be a leader in a society can provide new role models. Arts and theater can be used. We can use self-affirmation practices to help people. This might sound far out, but it's been shown, for instance, in schools in the United States, that when after a 2-hour self-affirmation exercise, low-performing kids do better in grades 2 years later. It's quite powerful. We can also change the collective meanings of practices so that certain practices which are branded bad become branded as acceptable. Female genital cutting and mutilation comes to mind, and there's been work in that regard. Finally, social norms. We think socially. We are fundamentally social beings. We want to cooperate with others. We punish others who do not cooperate with us. There are social emotions, disgust, anger, honor, that matter a lot for our choices. So the policy ideas here are that information about what others are doing matters a lot, not just about performance, as I mentioned, of a certain service provider, but what others choose to do. We can provide information to people about, say, how a school clinic is, a clinic or a school are not doing very well, and people might respond fatalistically and say, well, it's always been that way. But if we tell them, 80% of people around you don't like this, that's a different bit of information, and it may be empowering and promote collective action. So those are the main ideas in the report. And let me briefly just summarize them very quickly. Paying attention is costly. Self-control is hard. We see through cultural lenses, and we think socially. Now let me provide a couple examples of these ideas. First, paying attention is costly. In Kenya, there was a study in which people were given reminders via text, SMS, to take their antiretroviral medication for HIV/AIDS. People who received no reminder achieved a high level of drug adherence 40% of the time. People who received a weekly reminder adhered to their drug regimen 53% of the time. That's something we can use, not only in the context of drug adherence, but in the context of savings and other kinds of things we want to get people to do, but which, for some reason or other, they don't find themselves paying attention to. Notice, interestingly, the weekly reminder was more effective than the daily reminder, which basically had no impact. The daily reminder apparently became the wallpaper, became background, became something that people didn't focus on at all. This raises, I think this interestingly highlights the point that in this area, we need to think about testing what we do. We may have a hypothesis about the kinds of reminders that will help people, but we need to actually go out and try it and see what works best in a given context. As I said, we need to think about asking the right questions, and we need to be thinking about how people actually make decisions, and we can't assume that our models of it are always accurate. Here's another idea. This is from that great philosopher Dilbert. This is Dogbert's retirement planning service. And someone comes in and asks, and it's told that my fee is 10% of your portfolio for the year. And they say that sounds reasonable. And someone says, none of my clients understand how the future works. Things can be quite complicated. People don't typically understand portfolio decision making. Many of us also do not. But the general point is that simplification can be important, and we should use it, as I mentioned, in a variety of contexts, including program enrollment. Here's an example of what is called a frame. Notice squares A and B. It looks like B is lighter than A. But let's see what happens when we take out that shadow that's being cast by the cylinder. I hope this shows up on your screen effectively. In fact, A and B are the same color. The context matters a lot. It shapes what we pay attention to and what we focus on. How things are presented for us changes how we will behave and how we will choose. When things are presented, for instance, in terms of a loss, we pay attention in a different way when things are presented to us in terms of a potential gain, even though they may be two ways of saying the same thing. This has been shown to motivate teachers in working hard. To present things in terms of a loss can make a difference. The next point is that self-control is hard. This slide shows you the results of a study involving a medical scheme, private health provider in South Africa. This healthcare provider would give people a 25% cash back reward when they purchase healthy foods, whole grains, fresh fruits and vegetables, low-fat dairy. Now, a number of people in this who are subscribers of this health scheme were offered this contract. They were said, would you like to increase the amount of healthy food you purchase by 5% over the next 6 months? If you fail to do that, we will take away your 25% bonus. 36% of people took up this offer. This in itself is interesting. From a standard traditional point of view, no one should take up this contract because you can only lose. There's nothing to be gained. There's only a penalty if you fail to meet your target. But a third of the people decided it was worth it to them to take it up. Now what happened? You can see that in the green line, the people who committed to this contract increased their share of healthy food. Those who didn't take up this contract but were offered it, and those who were just told about the general idea that it might be good to lower your unhealthy food consumption, they didn't really change their behavior very much. Researchers went back and found that this lasted 6 months after the program ended. So this is a commitment contract to promote self-control. This idea has been used in the context of smoking and in the context of savings as well. Markets typically don't provide this kind of commitment contract because most people don't understand that they have a hard time with self-control of this type, or if they do understand it, they don't quite get to the point of wanting to sign this kind of contract. A third of the people signed up here. The second reason markets don't provide it is because if they do provide it, if one entity, a health scheme, provides it, another entity can come in and undercut that first entity. In this case, even though people were purchasing more healthy food themselves, those who signed the contract, then they may have been able to purchase unhealthy foods from another source, not using the credit card from the health scheme. Self-control is a challenge, and commitment contracts are one way to address that problem. The third idea I want to mention is that we see through a cultural lens. Here's a graph, a couple of graphs from a paper on climate change. People were asked, how much risk do you believe climate change poses to human health, safety, or prosperity? In the left side was the hypothesis. This is the public irrationality thesis. The idea here is that as people become more numerate and more scientifically literate, they're more likely to believe the 97% of scientists who think that climate change is real and caused by human activity. So if we give people more information, things will get better. That's the left side. On the right side is what people actually observed. In fact, there was no relationship between increasing literacy, scientific literacy and numeracy, and likelihood of believing of the risk of climate change. The researchers broke this down further and found that actually, if you divide this into two types of worldviews, people who are sort of hierarchical and people who are egalitarian, there's a big difference here. And the lack of impact and somewhat declining impact is actually the result of people who belong to a particular worldview, which they label as hierarchical. So the idea here is that people use their rationality, their numeracy, their scientific literacy, not only to figure out what the truth is, but to express which group they belong to. They belong to a group which does not want to believe this and use and discount the information that they receive, even though, and especially when they are more numerate and more scientifically literate. Cultural lenses, in this case, the worldview you have, matter a lot for how we see information. Now, this is often described as confirmation bias. Here's a cartoon in which the boss comes in and says, take your feet off your desk. And the worker says, is this an example of random management, or do you think it will make our stock rise? And then the boss says, it's up 0.02%. Not so random after all. Of course, 0.02% is noise, but we have a tendency to find evidence that supports our prior views. It's a phenomenon that affects not just, obviously, not just people who are the objects of development policy, but the policymakers themselves, ourselves, and we need to keep in mind that these decision biases affect us too. Another idea of the importance of culture, exposure to TV role models reduced fertility in Brazil. This graph shows the years after the arrival of O Globo, in particular municipalities in Brazil. O Globo was a television station that showed a soap opera relating to fertility, and you can see the effect after this TV station became, when people could watch it in their communities. Now, the researchers here attribute it to the soap opera because when there was O Globo coverage, and people could access the soap opera, there were more kids with names of soap opera stars. There were decreases in fertility just after episodes with plots about upward mobility, and there were stronger effects for women whose age was close to that of the main character. This raises the general idea of entertainment education. This kind of story about the effect of soap operas has been shown in a lot of other contexts as well, and we think it could be useful in development policy. Finally, we think socially. This is a picture of a road accident in a collective vehicle in Kenya. Road traffic accidents are among the top 10 causes of death in Kenya. What can reduce them? You might think it's regulation, making things, fining people for not wearing seatbelts, creating a technological device that disables a motor. But of course, sometimes when that happens, people find ways around it. There are stories that in Kenya, when this device was established that disabled the motor if the vehicle was going too fast, people developed a disabler for the disabler, or governor for the governor, which then made that ineffective. What else can we try? How about a sticker? There was a sticker put on a bus that reduced bus accidents by 50%. The sticker said, "Don't just sit there as he drives dangerously, stand up, speak up now." This apparently had the effect of getting people to protest when drivers were driving recklessly, or maybe bus drivers, vehicle drivers who had the sticker on the bus themselves drove more cautiously because they thought other people were now able to stand up. So this changed the social norm, encouraging people to stand up and protest. That's another way in which that's a kind of policy intervention that we can begin to think about, directly targeting social norms. In Uganda, people attributed a decline in 35% decline in road accidents to speed bumps. In Bogota, Colombia, in the late 90s, people used mimes to encourage people to slow down and to not to be careful when pedestrians were crossing the road. So those were examples of the four main ideas we want to put front and center in this report. So let me leave you now with three questions to think about. The first question we should be asking ourselves is, what are the mindsets of the people policymakers are trying to reach? We should ask questions like, how do people we're trying to reach think that their life destiny depends on their own choices? This is a term that psychologists use is called locus of control. But do people feel in control of their lives? Yes or no? We don't. Some people do and some people don't, and different people do at different times. Understanding that information can help us design policies, because sometimes those policies depend on people making good choices, depend on people taking control of their lives. You can ask questions about the cultural lenses people use. You can ask questions about the information they have about the beliefs of others and their expectations. And then finally, we can ask questions about how sophisticated they are about their own knowledge of their own biases. We can ask questions about the decision traps that we policymakers might be falling into. We should ask ourselves, are we overly attached to our assumptions? Are we overconfident? Are we looking for information that confirms what we already believe? Are we attached to a course of action even though it's going to fail? And finally, how can we systematically, through policy design and regular policy practice, talk about the mindsets of others and our own decision traps in a systematic way? Thank you very much, and I look forward to our conversation over the next few minutes. I think we may turn now to some poll questions.
Yeah, thank you, Varun, for this fantastic, interesting presentation. We will move forward to these poll questions. We have three questions. Let's see if we have time for all of them. So, audience, please feel free to answer to these questions. So the first one is Linda is 31 years old, single, out of sport, and very bright. She majored in philosophy. As a student, she was deeply concerned with issues of discrimination and social justice, and also participated in anti-nuclear demonstrations. Which of these two statements is more likely? Linda is a bank teller. Linda is a bank teller and is active in the feminist movement. So we're going to wait a little bit to see if everyone can participate, and Varun will comment a little bit. Okay, I think it's time to comment. So we have 14% who says A, 85% who says B.
This is a classic question in cognitive psychology and behavioral economics. The insight here is that Linda is a bank teller, is a larger set of possibilities. If she's a bank teller and a feminist, that's a smaller set of possibilities. Because if she is a bank teller and a feminist, she's certainly a bank teller. So logically, the first answer has to be more likely than the second answer. Why do most people focus on the second answer, as the people did in this poll? Because of something called the representativeness heuristic, or the conjunction fallacy. People aren't able to put this together, typically, and people focus on what jumps to mind. Linda seems like a feminist. That's very present in our minds. And we don't necessarily think about the logic behind the question, but focus on what's immediately available. This kind of phenomenon affects a lot of the policies we undertake. Other examples of this are, for instance, when you ask people in developed countries what's more common, homicides or suicides, people typically say homicides because that's what the newspapers report, but in fact suicides are commonly more frequent than homicides. What's more common? Traffic accidents or stomach cancer? Well, people typically say that stomach cancer because it gets a lot of attention, it grabs your mind, but traffic accidents, in fact, are more common in many countries. So this is the representativeness fallacy, heuristic, and this affects how we regulate, for instance. People, when regulators are developing policy, they focus on what's in the newspapers, what comes to mind, rather than, as the Nobel Prize winner Daniel Kahneman put it, thinking slow. People think fast when it comes to a lot of these issues. So thanks for all your thoughts on that.
Let's move to the second question. So the second question says, college attendees rates are low among low-income populations in the United States, despite financial aid from both federal and state sources. A recent experimental evaluation, however, found a 29% increase in attendees. What do you think was behind this increase? We have several options. The first one, an increase in financial aid. Second one, assistance with filling out the application form for financial aid. A targeted information campaign to low-income high school students about prospects for admission in various colleges. A school voucher program that brought low-income high school students into private schools. Let's wait a little bit. I'm seeing most of the people are going to B. We're going to close the poll here, and we have a winner. Option B.
Option B is, in fact, the finding from the study. There was a study in the United States in which a group of families, low-income families, were offered assistance in filling out financial aid forms for colleges at the same time as they were filling out their taxes. The control group was just given some basic information. A second group was, the second group was given a little more information, and then the final group was given actual pre-populated form, which helped them fill out the application form. So one group got a brochure with information. The other one got personalized aid estimates based on tax returns and information on tuition costs. And then the final group received a form that was actually filled out. The people that got the form that was actually filled out were 29% more likely, those kids, to go to college. So it had a very large impact on college enrollment. This was simply helping people fill out a form. Other people got the information to fill out that would help them fill out the form, but didn't actually get the form filled out for them. This is a great example of the impact of limited attention. People simply don't have the wherewithal to fill things out themselves. And when they receive a little bit of assistance, when things are simplified for them, it can make a big impact on what actually happens on schooling, enrollments, and development outcomes. So I think the audience members got this one right, but it's a great example of what we're trying to highlight.
Okay. Before moving to the third question, just let me remind everyone to ask questions through the chat pod, questions or comments. Okay, here goes the third one. If the aim is to understand people's mindset better, what should World Bank do more of? Do more impact evaluations and do them better? Require bank staff to spend more time in developing countries or in villages? Hire more psychologists, sociologists, and anthropologists?
Or use checklists.
Okay, see. Okay, number B is going to be the winner. Okay, let's close the full question here. So number B, Robert Bank staff to spend more time in developing countries or villages is the option that the audience chose.
Very interesting. These are all ideas that may be relevant and hopeful and may be useful for us, for World Bank and other donors and other development policymakers more generally, to take on board. Do more impact evaluations and do ones that focus on mindsets of people, not just outcomes, development outcomes. Have more exposure to developing countries. Bring on board people who are specialized in understanding mindsets and psychology and behavior. And then finally, to try and combat our own biases, to use checklists and internal monitoring. So we think all these ideas are important and interesting, and it was very noteworthy to me that most of the respondents focused on exposing World Bank staff to developing countries and villages, which may have the effect of helping them understand the mindsets of people we're trying to help more. So thanks so much.
Okay, now we're going to move to open questions. So again, everyone, feel free to ask any questions or comments about the presentation. Yeah.
History. Development policymakers, governments, in fact, all of us have made mistakes in the past. And of course, if you don't understand history, you're doomed to repeat it. And historians can help us get a handle on why certain projects and policies took the directions that they did, and why how that can be used in the present. And it also just opens up our understanding of different mindsets. For instance, in some of the work we're doing on climate change, one really striking example that comes out is that when English settlers came to the United States, came to Virginia in the early 17th century, they thought that Virginia would be like southern Spain. You could grow pomegranates and olives and all kinds of tropical fruits because, of course, Virginia was south of London. And they thought that latitude was the best and the exclusive predictor of climate. What's striking is that people persisted trying to import and grow these tropical fruits 13, 14 years after they arrived, despite all the evidence to the contrary. They thought every year was just a fluke. So what that means is that our mindsets about climate are very hard to change. And that's that example is taken from a historian, and it's really quite enlightening in helping us think about mindsets, in this case, one that's relatively universal, the mindset about how we typically confuse climate with weather.
We have a question from Clay Westcott. Does the current bank change process seem to reflect any of these WDR 15 findings?
Well, the WDR15 findings aren't quite final, and the change process is certainly not quite final itself. Um, I would say that one, one insight that we have is to try and bring different kinds of information together. Multidisciplinary teams, trying to do information exchange more effectively. That's one way to reduce the biases that any of us as individuals have, is to deliberate together. Um, uh, there's a political scientist, James Fishkin, who talks about deliberative polling and how when you get people together to focus on issues, it can reduce some of their biases and enhance their decision making. That idea of trying to get information to flow better is certainly behind the change process as a goal. I think it shares the same goals. How things play out, of course, we will see.
So we have another question from Alejandro Deep. How do you define mindset and how do you measure it?
Yeah. So mindset is a general term, and we use that to describe the orientation towards decision making that people have at a given time in a given context. That then is broken down into how they think about the choices in front of them and the influences that the four factors that I mentioned have on it. So we would think about, for instance, a social norm, which may affect an attitude towards decision making, and we would measure that by asking people not only what they think is the right thing to do in a given situation, but what they think others will do in that situation. Because social norms are in fact social facts. There are expectations about how others behave, as well as expectations about how you should behave. So that's one way of trying to measure social norms. There are different approaches to measuring and identifying the variety of heuristics that I mentioned. Behavioral economists talk about a present bias, and there are ways to measure that in the lab or in the field. People can also talk about representativeness, and that Linda example is the Ben Keller example is an indication of how one would measure that heuristic. There's in fact a lot of evidence about this now, and if you're interested, I encourage you to read books, for instance, like Thinking Fast and Slow by Daniel Kahneman, some of Dan Ariely's books. There are a number of powerful findings out there that we're drawing on for the WDR.
Talking about mindset, Akshay Ragni says, how can we make sure the input of those whose mindset we are trying to change is captured? What kinds of data tools we can use?
Yeah, so we hope that we can do that more regularly in development practice and in development policy formulation and when projects are assessed. So for instance, one of the questions that comes up from time to time involves immunization and vaccines. There's a view out there, I don't think it's very widespread, but there's a view out there in some environments that vaccines are dangerous. They can cause sterilization. In some contexts, they can cause autism. This happens all over the world. In the mid-'80s in Sweden, there was a scare regarding vaccines, and I believe it was autism. And the coverage rates for some of the key vaccines went down to 10%. And Sweden had outbreaks of diseases that are entirely preventable as a result of this. And the prevalence and incidence of some of these diseases were in line with a country that was much poorer. So this happens anywhere, but one of the things we, for instance, can think about is why aren't people signing up for vaccines? Maybe it's a mindset, or maybe it's a view that they're dangerous. And if that's the case, we should not only offer the vaccine and send people out, but develop an approach using local leaders to fight against that mindset. Of course, recognizing that there are dangers, but putting them in proper perspective. So that's an example of how we can think about certain mindsets that are important for development.
We're receiving a lot of comments and questions. We're not going to have time to answer all of them, so I'm going to try to pick one of the questions at a time, and let's see until when we can wait. So Nazis Pachani says, "What about empowering mother of a family?"
Yeah, absolutely. Empowerment matters a lot. That's something that the World Bank has been focusing on for quite some time. Gender issues are important. When mothers are educated, the outcomes for children in terms of education and health improve dramatically. That's one of our mainstays in development practice. Um, Now, the stories behind that are often that when you empower women, you increase her bargaining power in the family, and therefore more money goes to kids' issues or other issues that mothers find important. That's absolutely true. Where we may be able to complement that a little bit is the notion of role models when mothers and other women are put in positions of authority. One of the results may be that people are less biased against women, and they think that women can lead. In an interesting series of papers involving political reservations in India, the finding was that when women were village leaders, it was more likely that girls would spend less time on household chores. Attitudes towards women and women's roles changed, and women were found to be more effective leaders, perceived to be more effective leaders than they were in the past. So we want to complement that traditional story about bargaining and women's power by saying it also changes mindsets and attitudes.
Um, Sheree Fayed says, "Solution seems more like bandages, not sustainable solutions. How does the World Bank Group develop more sustainable solutions to these issues?"
Yeah. So as I mentioned, the research is relatively recent, and we don't necessarily have an approach. We don't know how long-lasting some of these interventions are. One intervention that does seem long-lasting is the idea that using social norms can reduce energy consumption. When a series of consumers were given information about how much electricity they used, um, and were and had that information benchmarked to how much electricity their neighbors were using, that had a lasting impact on energy consumption 5 years into the future, compared to people who just got the information about the prices and quantities of electricity that they themselves used. In other words, the social norms approach to energy conservation seems to matter for a long period of time. Now, I think where this questioner may be headed is that this is not a substitute for focusing on some of the structural issues around development. For instance, we won't be able to address climate change effectively without a massive effort to change our physical technology, retrofitting, replacing our energy production systems, our cars, our vehicles, cooking up everything. That's a technological solution. It involves technology, it involves prices, it involves incentives, standard stuff of development, and of course that's important. But we want to say that there's also a behavioral story and a decision-making story that matters a lot, not only because people have to choose to drive a car or choose to consume a certain amount of energy, but because the policymakers themselves that would be adopting these policies which would promote retrofitting technology themselves are making decisions and subject to these biases. So while I agree that structural issues are important, we want to emphasize that the behavioral story is quite compelling as well.
Another question about mindsets. Kamran Lawani says, "How can we change mindset of people if they are hindering healthcare services?"
If they're hindering healthcare services. Well, we will have a chapter on health, and there are a variety of approaches that people point to with respect to healthcare. Professional norms may be an understudied and underemphasized part of the field of service delivery. The 2004 World Development Report focused on service delivery and focused on the behavior providers. It led to a powerful set of studies which emphasized the absenteeism, teachers and clinicians in developing countries. And the argument was there that we need to focus on incentives to get people to show up better and provide better quality services. And that's right. At the same time, as Shanta Devarajan, who is the co-director of that report, mentioned in a recent 10th anniversary retrospective, we need to understand more about social norms. In some countries, people get paid, providers get paid whether or not they show up, say Finland, but teachers still show up regularly because of professional norms. The same is true of clinicians in a number of environments, and there are dedicated clinicians around the world. We need, I think, by focusing and putting the spotlight on norms, we hope, launch an effort to understand how they arise, how they're sustained, and how they can be used to enhance health and education service delivery more effectively. We're not there yet, but we hope that this is the beginning of an interesting agenda.
We only have time for one more question, and I think that this, being the end of the presentation, it's the one that we should address. Kerry Platay says this is fascinating topic for the world, for the WDR. Very pleased to see that bank is exploring this topic. How might the bank group learn more from this WDR? As seminars plan, what educational opportunities among staff and our partners do you hope are implemented after the WDR is released?
Thank you. We've had a series of, in my view, fascinating speakers come and present seminars related to the WDR. We've had some outreach around the institution. We will have our launch in the fall, and after that, we will certainly be pushing for the efforts to bring this perspective into World Bank and analytic work as well as policy and programs. The dissemination phase of the WDR follows the production of the report. Right now, we're very focused on getting a good report finished and on the table, but after that, we very much hope to focus on bringing this to the attention of development staff, not only here, but around the world and in governments as well.
Is there any other thought before we close the webinar? Do you want to?
Thank you all so much. As I think some people have mentioned, this is a somewhat new topic for the World Bank, and we would very much appreciate the support and interest that all of you have shown in bringing this idea to your own communities, to your own work environments, to your colleagues, to try and get this perspective on the table, because it's not something that we can do alone, but we hope that with all of you we can bring mindsets and behavior change to the front of development practice. Thanks so much.
Thank you. I want to thank Varun for this fantastic presentation. As well, I want to thank the audience for this interesting discussion that they had. I want to remind that the presentation, the recording of the webinar will be available in 24 hours on our website. We will do the same presentation in Spanish on April and that's it. Thank you again.